Everyone, and thank you so much for taking time out to join the family support presentation and discussion. Today, we're going to be speaking a little bit about the phases of treatment. Sky, if you wouldn't mind going to the next slide so long. So I think we're going to have a look at the principles of effective treatment. So what constitutes effective treatment? We're going to have a look at the importance of continued treatment. And more importantly, I think we're also going to try and apply that to the changes system. And we're going to try and educate you on some of the different phases that we have at changes and how that ties in to this continuum of care. Right. So first is the principles of effective treatment. So in other words, what are some of the factors that contribute to treatment being a success? I think for everyone on this platform, I'm sure when you have made the decision to take your loved one to treatment or for your loved one to enter treatment, there's always, that hope that this is going to be effective, this is going to work. They're going to leave treatment and they're going to be able to maintain their recovery. So I think it's important that we look at what are some of those factors to contribute to that actually being the case, and to this treatment process being effective. So the first one there is that addiction is a complex but treatable disease that affects brain function and behavior. So I'm sure that on these platforms you've heard on many occasions that different substances affect the brain and the brain structure and therefore how it functions. This results in changes that persist long after drug use has ceased. This may explain why drug abusers are at risk for relapse, even long after periods of abstinence and despite the potentially devastating consequences. So I just want to pause there for a moment. And when we speak about these changes that happen in the brain, I think it's important to remember that addiction targets the reward system of the brain, it targets motivation, impulse control. Um, and if all of this isn't managed and if all of this doesn't almost reset, there's a high chance of cravings and there is a high potential of relapse. So research has shown that within the first 30 days, there is a little bit of change that happens and there's a little bit of healing that takes place in the brain. But predominantly, the 90-day mark is a really good place where some of those changes start to happen and we can actually start seeing some of those changes. But it's also found that most of these changes take place within a year. So in order for the brain to kind of reset to its normal benchmark, it takes about a year for that to take place. So again, the primary care treatment, which I'm sure most of you are used to and are familiar with, is a 21 or 24-day period. So that doesn't take us nearly to this 90-day mark where a lot of those changes and that healing starts taking place. And it's also very, very far from that 1 year mark. So ideally, treatment is most effective when it gets us as close as possible to that 90-day mark or to that 1 year mark. The second point is treatment needs to be readily available. Because drug addicted individuals may be uncertain about entering treatment, and I'm sure that statement is something that most of you can relate to. There's often a reluctance to go into treatment, one, because a person wants to continue in their addiction, but also because it's difficult. We often say to the patients that are in our care, we understand that being in rehab isn't always easy. It's really challenging. You are away from your family, you're away from your loved ones, you're away from your daily comforts. You have somebody telling you all the time what you need to do, where you need to be, what you need to eat, etc., etc. So yeah, it's really tough. There's also things like boundaries and rules, something that addicts aren't used to. So treatment isn't easy, and often it's met with resistance. And if there is a recommendation for extended treatment, that is also met with resistance. I think it's very, very seldom that, discussions are had around extended treatment or longer treatment where the individuals are just really excited and happy to go. So I think it's really important to have these discussions while your loved one is in treatment. And I think the saying that strike while the iron is hot, while they are in treatment, while they are in a space where they're being held and being supported by professionals, it's a really good time to have those conversations with your loved one, with their therapeutic team, to discuss ongoing treatment. Again, because it might be met with resistance, but because they're already in that environment, it often makes it so much easier. And you're not on your own having this discussion. You also do have the backing and the support of professionals trying to explain things to both yourself and to your loved one. And if there is the resistance, we can often work with that resistance. We roll with that resistance. We hold them until there is a buy-in into treatment. Next one, Scott. Okay, so the next one is something that I've already mentioned, and that is remaining in treatment for an adequate period of time is critical. So during this presentation, on a few occasions, you will hear me referring to this 90-day mark. So the appropriate duration for an individual depends on the type and the degree of the patient's problems and needs. But research has indicated that most addicted individuals need at least 3 months. So again, that 90-day mark in treatment to significantly reduce or stop their drug use, and that the best outcomes occur with longer durations of treatment. So as we also say in our preamble, recovery from drug addiction is a long-term process. And we're also going to touch a little bit on why that is a long-term process. But again, just from scientific research, that 90-day mark shows that when patients have been in treatment for 90 days, the risk of relapse reduces drastically compared to patients who have just done a short-term 21 or 24-day treatment program. The next point is effective treatment attends to the multiple needs of the individual, not just his or her drug abuse. And this one is the one that ties into number 3. So to be effective, treatment must address the individual's drug abuse, but also associated medical, psychological, social, vocational, and legal problems. So if the aim was just to get your loved one off of substances, that happens pretty quickly during the process. They enter the treatment, they start detoxing. And I mean, if we were to ask them to submit to a urine test, they will start testing clean. In other words, they are off the substances. But recovery is so much more than just stopping the use of the substances. It is about all of these things that we have listed here, but it's also a lot of skills that need to be learned. It's a lot of education around addiction, education around recovery, education and getting them to a place where they have insight into their behaviors and the impact that their behaviors have, and then getting them to change that. And not only change that, but also a period of time to try and really get that implemented. So all of these things take time. You can imagine that that's really, really difficult to achieve within that 21 or 24-day period. Number 5, an individual's treatment plan must be assessed continually and modified as necessary to ensure that it meets his or her changing needs. Very much something we do at Changes. So while the groups and the lectures, everyone attends that, but we're very well aware that each individual that comes into our care, that they do have specific needs and specific requirements. They also have a different background, and therefore those things need to be addressed accordingly. So once an individual enters treatment, we have a post-admission interview or a biopsychosocial interview with the patient. And in there, we gather a lot of relevant background information in terms of family of origin, their current family, when their using started, how it's progressed, if there are any legal problems, if there are any vocational problems. So that helps the treatment team to compile an effective individual treatment plan for that patient. What are their needs? What needs to be addressed in this period of time? And as we continue and later have a look at the different phases of treatment, you will also see that that's something that continuously gets assessed during the different phases of treatment. Something that's really effective in that as well is our case management meetings, and those meetings take place once a week for the different phases of treatment. So we discuss the primary care, we discuss the secondary care, we discuss halfway house, outpatient, aftercare, living recovery. All our phases of treatment get discussed in case management. And the beauty of that is that you know that it isn't just one person that is overseeing your loved one's treatment, but that there is a group of individuals and a group of professionals that all kind of give input around that. So even though their primary counselor might be the one presenting on a particular patient, they do have the input of the whole discipline and multidisciplinary team to kind of guide treatment and help treatment. So yeah, I'm not going to read all of that. I think it's pretty much explained. Number 6 is many drug addicted individuals also have other mental disorders. So this is what we refer to as co-occurring disorders. So because drug abuse and addiction, both of which are mental disorders, often co-occur with other mental illnesses, patients presenting with one condition should also be assessed with the other or for the other. When these problems co-occur, treatment should address both. Or if there's more than two, then it should address all of these conditions, including the use of medication as appropriate. And that's obviously where our psychiatrists come into play. All the patients are assessed early on during their treatment program by a psychiatrist so that we can identify any co-occurring disorders and that we can start with treatment as soon as possible. If patients do progress to other phases of treatment, then they also do have follow-ups with the relevant psychiatrists to continue, ensuring that they are getting the appropriate treatment. Number 7, treatment does not need to be voluntary to be effective. And this is sometimes a bit of a tricky one. So boundaries or enticements from family, employment settings, and or the criminal justice system can significantly increase treatment entry, retention rates, and the ultimate success of drug treatment interventions. So what that means is that you have a say. It's not just up to the addict or your loved one in treatment, whether they want to be in treatment, whether they want to continue with treatment. We really do believe that your opinion and your voice matters too. And so often, addicts come into treatment and they're completely reliant on their loved ones, whether that be for housing, whether that be for financial support, etc., etc. And I think sometimes it's quite important to say, well, we don't believe that you're ready to come home. And if you do come home, and something happens, our hands are off. We're not getting involved. We can't provide you with that support because, at some point in time, that help actually becomes enabling and it just keeps feeding their addiction. So it's something that I would definitely recommend that you speak to the counselors or the therapeutic team about. If you really do feel that your loved one perhaps needs extended treatment, but they are resisting, please feel free to communicate that to the therapeutic team and they can advise you and they can support you and maybe guide you in terms of the boundary settings and the bottom lines that we often speak about. And often we arrange for conjoints to take place where this can be discussed openly, but absolutely, it's not just up to them. You also do have a voice. I just briefly want to mention when we refer there to the criminal justice system, there is something called a court order. And what that simply does is that almost removes the choice from the individual and they get placed into treatment center. And that treatment center is the treatment center of your choice. But what that pretty much says is it's just saying that this individual, because of their substance abuse, is in a place where they cannot make healthy decisions for themselves, and the decisions that they're making aren't in the best interest of them or for their loved ones. So often the courts do intervene and they can order somebody into treatment. Thank you, Scott. Okay, so Those are some of the things that play a role in, like I said, treatment being effective and treatment being a success. So, what does treatment at Changes look like? Sorry. Changes offers the full spectrum of addiction treatment to a multitude of patients in various phases of treatment. Okay, we do this through high quality, specialized clinical care, family support, exactly what we're doing tonight, and reintegration services. And we're going to have a look at what all of these things mean. The treatment is personalized. We've already spoken about that to each patient, and individual treatment plans are developed for each client's specific and unique needs, no matter what phase of treatment. We offer primary, secondary, and tertiary rehab treatment programs. And for those of you to who all of these words and terms seem a bit unfamiliar, we're going to touch on that and going to explain what all of that means. But we also provide different outpatient options that are aimed at achieving lasting recovery and sobriety. So that's the aim, like I said in the beginning. When you send your loved one into treatment, it's not just a case of let them take a bit of a break, let them clean up for a little bit. I'm sure when you send your loved one into treatment, the idea is to make this last. When they leave there, for them to be on a path of recovery. And that's our aim too. Okay, so I'm just quickly going to go through this just to give you an idea of the different phases that we do have. And we're going to discuss each one of these in a little bit more detail. Primary care is the one that I'm sure most of you are familiar with. That is where 99% of our patients do start their journey, is in primary care. Um, our long-term treatment is the secondary care, also referred to as River Manor or the farm. Halfway house is our tertiary care treatment, and that is for integration services, reintegration services. And then some of our outpatient programs is the outpatient itself, aftercare, and living recovery. But we're going to look at a bit more detail now. Okay, so the first one, like I mentioned, is primary care, and that's the one that most of you are familiar with. So primary care is offered on an inpatient basis. What that means is the patient stays at the facility, they sleep at the facility, they eat at the facility, they are inpatients. This is the most intensive phase of treatment, often referred to primary care as being the ICU of treatment. If you think about when one has to go into hospital and go into ICU, it's really intense. There are so many nurses. I mean, usually you get one nurse that's just assigned to you, but you get somebody assigned to you, see them on a regular basis, see doctors. There's a lot of monitoring. It's really, really intense, often for a shorter period of time before you then go to almost a bit of a step down in care where the treatment is not that intense, still good treatment, but it's not as intense as the ICU. What happens in primary care? One is the detox, spoken about that. So when your loved one comes in, there's the dependence on the substance, and because of that, they need to go through a detoxification process. Detox is where our experienced medical team manage the detox process. The aim of the detox is to safely remove substances like alcohol and drugs from the body while managing the withdrawal symptoms. Once the patient's withdrawal has been medically managed and detox is complete, the main focus of primary care is starting to dismantle that denial. So when we speak about dismantling the denial, one of the I want to say we refer to it as pillars, but one of the faces of denial. So one of the ways that denial shows up is absolute denial. So that thing about I don't have a problem. But also sometimes people don't see the severity of their addiction. They don't see how broad the consequences are. They're not really in touch with the reality of the amount of damage and hurt that their addiction has caused. And that's what it means when we say we need to dismantle the denial. We need to start getting them to a place where they see the reality, where they start seeing the real picture of what their addiction looks like. So the objective is to narrow the discrepancy between the patient's flawed perspective, that idea that they have about their addiction, versus the reality of what it actually looks like for them and their loved one. It's only when the patient has an acute awareness of the severity of their addiction that they will be able to take responsibility for their recovery. So, yeah, getting them to a place where they can actually see the seriousness of the problem, that's when they can commit to the changes. Okay, so what does treatment include at primary care? It includes individual counseling and therapy. We focus on the 12-step treatment program. It's a lot of group therapy that takes place on a daily basis, and that can be in different forms. Sometimes the groups are specifically there to dismantle the denial. Sometimes the groups take on a more educational format. The groups can sometimes be gender-specific groups to give people the opportunity to speak about and relate about things that are very gender-specific. So different kinds of group therapy. Lectures or didactic training where patients get educated on the disease of addiction, but also on a lot of the recovery tools that they do need. Occupational therapy, there's also consulting psychiatrists, and as we mentioned earlier, there's that management of the comorbidity. During this phase, patients are equipped with knowledge about their disease and a multitude of tools they can use to avoid relapse and stay clean and sober. Each patient's therapy is individualized. We've spoken about that, and that happens in conjunction with the patient, but as well as with you, the family, and the loved ones. So, one of the ways that we do that is we ask families to write collateral letters to just give us some of that additional information, but to also perhaps write a letter to their loved ones. And there's also the conjoint meetings that take place where you have the opportunity to speak directly to your loved one. But there's also the weekly phone calls where you have the opportunity to speak to their therapist and give some feedback to their therapist on their addiction, but also perhaps what you're experiencing in your weekly phone calls when you get to speak to them. So your input is very, very valuable. Recovery is a lifelong process that doesn't end when the patient walks out the door. While in primary care, the therapeutic team helps the patient make a custom plan for continued care. This could include secondary care, tertiary care, or some form of outpatient treatment. So sometime during the primary care phase, the therapist must start speaking to you about what their recommendation is for when your loved one does leave primary care. And some of that might include going to the farm, continuing with long-term treatment, or joining one of our outpatient programs. Okay, so long-term treatment. What is long-term treatment? So there is not a one-size-fits-all approach to recovery. Treatment programs vary very much in terms of their setting, the duration, intensity, what's offered in different treatment programs. And again, that all depends on the individual's need. But for some patients, it might include long-term treatment. Me personally, I'm a big fan of long-term treatment. I suppose that's why I also I'm predominantly based at our long-term treatment facility. I've just seen the success that comes from the long-term treatment. Again, when we're speaking about long-term treatment, I do think it's important to mention that just because one only does, if a patient only has the opportunity to do a 21 or 24-day program, that doesn't mean that they don't have a chance of success. There is absolutely a chance of success. So I just want to put it out there. It's very important to mention that. However, research has shown that if we get to that 90-day mark, the chance of success is so much more, and the chance of relapse just diminishes so much more. And again, I think it's quite evident in the amount of work that we need to get through why that 21 days or 24 days is just not effective. And I think for a lot of us that work within this field, um, I know that a lot of our patients do rely on medical aid payments, and medical aids, unfortunately, only cover primary care costs. And I know for a lot of us, that's so sad to see because we know that there is such a great need for that extended treatment, and we have seen the effectiveness of long-term treatment. So it is sad that medical aids don't pay for longer term treatment. They only pay for the 21 to 24-day treatment programs, unfortunately. So ideally, short-term rehab programs are followed by long-term residential treatments or an extended outpatient. And again, it's because recovery takes time. Long-term drug rehab usually involves at least 90 days in a residential treatment setting. at minimum. Some rehab programs require or even encourage longer durations of stay. So for some patients, getting to that 90-day mark, it's good, it's enough. But so often we do have conversations and we do think it might be in this patient's best interest to have a bit of an extended stay in the secondary care phase, or alternatively they go through into one of the other phases of treatment. But research again indicates that most addicted individuals need at least 3 months in residential treatment to significantly reduce or stop their drug use, and that the best outcomes occur with longer durations of treatment. So the longer the treatment is, the more success it is likely to have. So again, treatment needs vary very much from person to person. Factors that might influence the length of treatment is the severity of an individual's addiction, the length of their addiction. And something to keep in mind is so often their addiction has actually been going on for a lot longer than their loved ones are aware of. Previous treatment attempts can also have an impact on the duration of treatment that's needed, history of relapses, co-occurring substance use, and mental health disorders, as well as individual progress and how an individual responds to treatment. So the benefits of long-term treatment, increased chance of lasting abstinence. Again, just that anything less than 90 days in treatments tends to increase the chance of relapse. And I think we've covered this quite a few times in this presentation. Number two, it gives you the time you need to reverse the impact of addiction. And I think so often that when a loved one enters treatment, the family become more and more aware of just just how big this impact was. So often there's these little skeletons that come out of the closet. People are starting to phone, wanting money. You perhaps find out that your loved one doesn't actually have a job anymore. They've just been pretending to go to work. Um, Sometimes family members get to a place where they actually feel that they can start opening up about the damage that they've experienced because of the addiction. So just as it takes time to develop an addiction, it takes time to address the effects of addiction and develop habits that promote recovery. So, one, we need to address the addiction, we need to speak about the addiction and all the damages, but we also need to speak about and teach effective coping tools and what healthy living looks like. And that takes time. Long-term treatment provides extended time for the brain and the body to normalize. Again, we spoke earlier about that brain just coming back to baseline. And as I mentioned, 90 days, we start seeing a difference, but more or less here by the 1 year mark, we really start seeing big changes happening in terms of that. It helps also to solidify recovery and allows an individual to make lasting habits out of the coping skills and routines you establish during treatment. So when one is in long-term treatment, all these skills that you have learned over time, you also have the opportunity to practice that on a daily basis, and to get feedback and to see what works and what doesn't work, especially when it comes to families. So starting to rebuild those family relationships, and sometimes things still come up that hurt and that need to be worked through and that need to be processed. And I think while your loved one is in a safe environment, that also gives you the opportunity to address all of those things effectively. Number three, healthy lifestyle changes. So long-term residential rehab encourages and guides individuals as they make healthy lifestyle changes and develop healthier habits. So we focus on things like boundary setting. We look at what are healthy relationships and what are toxic relationships, effective communication styles, triggers. What are triggers in general? What is a patient's specific triggers? How they need to manage triggers, cravings, craving cycles, give them tools to deal with those cravings. Teach them about the 5 pillars. Teach them about reintegrating. So often we need to focus on the skills needed to actually go out and find employment, interviewing skills, how to conduct oneself, So there's a lot that goes into this healthy lifestyle change. Again, it's not just about being clean. It's not just about being off of the substance. It's also we educate them often about the culture of addiction and the culture of recovery. And those things look very, very different. The way one dresses, the way one speaks, the way one conducts themselves in addiction and in recovery, there needs to be a big difference. Otherwise, if nothing changes except for the substance, just, kind of disappearing out of the picture, it's only going to be a matter of time and your loved one is going to return to the substances because they haven't learned healthier ways of doing and coping. So the drug that they perceive as the one thing that did work and that did help them to cope, they will eventually return to that. So the next point is also it fosters close, healthy relationship with peers in recovery. And this is so important. So peer support is important in treatment and recovery. People who have never been addicted can't fully understand what someone in recovery is experiencing. And they may be unsure how to support a friend or a loved one. We often say that addict to addict help is without parallel. It's such a beautiful thing to see when addicts actually share um, similar experiences, when they also not just share the experiences, but how they've overcome those experiences and that it's possible to overcome. So through group therapy, workshops, social events, and recreation, peers in recovery help each other to stay motivated. They help each other to stay accountable and honest. Long-term rehab promotes the development of strong, healthy relationships that form over an extended period of time. These relationships are often very valuable once treatment ends. So once your loved one leaves treatment, some of these relationships that they have built can be very valuable in supporting them. Okay, another one is it keeps out distractions. When one is in treatment, when one is receiving treatment, specifically in an inpatient facility, it gives the loved one an opportunity to really just focus on their recovery. Recovery, especially early recovery, can be quite challenging. And if one is not ready yet and one starts reintegrating back into the home life, back into work life, needing to start mending these relationships and focus on recovery, that can so often be really, really overwhelming. And what treatment does is treatment just helps to ease that process a little bit. Let's solidify the recovery. Let's focus on the recovery. Let's get you to a place where you're strong and where you're healthy and where you really are able to tackle some of these stresses. And sometimes in the longer term treatment, we offer the support in some of this. Again, we have conjoints, we work through some of the struggles within the family dynamics. We speak about looking for work, etc., etc. So there's a lot of that support that takes place while the person is in treatment when the time is appropriate and when they are ready. Another one, it offers a high level of support. So support is one of the foundations of successful recovery. Long-term treatment provides sturdy support while in treatment and beyond. Support comes from the staff and the peers in recovery, and it's available around the clock. Working through the complexities of addiction takes time, and being able to reach out for help whenever it is needed in the early months of recovery is a major benefit of long-term rehab. So again, because they're in a safe place, because they're in a safe environment, whatever's coming up for them, whatever challenge they're experiencing within themselves, while they're busy working through the steps, working their program, whether it's a difficult phone call that they've just had with a family member, they're in a safe place where they can have the necessary support, whether that be from staff or from their peers. Recovery is not a linear process. There's a lot of ups and there's a lot of downs. And patients get to experience these ups and downs in a safe environment. And that also gives us the opportunity to give them the tools and for them to try and apply some of these tools that they have learned during the process. Thank you, Sky. The family has time to heal and work on themselves. So we often say addiction is a family disease. Although the one person uses, the whole family is impacted and the whole family suffers. And addiction places strain on so many relationships. So just like those relationships didn't just break down overnight, it's not going to take overnight just to repair those relationships again. That is a gradual process too. And if your loved one is in long-term treatment, it also gives you the time that you need to mend, but also to address the different struggles that you might have experienced within these relationships. And again, you get to do that while they are in a safe space, but you also get to do that with the help and with the assistance of the therapeutic team. Another essential part of long-term addiction treatment is the cultivation of a life rich in purpose and fulfillment. So we spoke earlier about the brain, and one of the big things about the brain is that addiction hijacks the brain's reward system, the dopamine system. So addicts are so often so used to living here. Everything is that extreme, and a big thing for addicts to learn is to find purpose and to find joy, not just in those highs, not just in those extremes, but to find it in the small things, in the everyday things, to get to a place where they can be grateful for being clean, for rebuilding family relationships, for for just the daily things that they have as well. So not just those extremes. Number nine is it allows for a deeper understanding of one's addiction. We've spoken about this quite a bit. An understanding of addiction. What is addiction? What is my disease? But also what can I do about it? So there's a lot of education that takes place. And number 10 is the skills development, which I think we've also focused on. So sustained recovery from addiction requires more than just abstaining from substances. So it's not just about stopping the use, but it also demands a comprehensive set of skills to navigate life's challenges without resorting to old habits. So again, we need to give them those tools. They need to practice those tools so that when they are faced with life's challenges, they use those tools and they don't return to the substances. Long-term addiction treatment is an optimal environment for skill development, empowering individuals to build a robust toolkit for lasting recovery. The extended duration of treatment allows individuals to not only learn these skills, but again, have the opportunity to practice those skills time and time again in real life scenarios. Thank you, Scott. Okay, so we spoke a little bit about the resistance. Resistance is really not something that's strange to us. Again, if an individual has an option of going to treatment, continue treatment, or go home and go out, they're always going to choose to leave and to go out. It's difficult to commit to treatment, and like we've mentioned before, treatment is difficult. It's challenging. I also often say to the patients that if they do this properly, this will be one of the hardest things they've ever done. But the rewards are so big. So despite all the evidence, we've spoken about some of that evidence, it is tough to convince some patients and sometimes even you as the loved ones that 3 to 6 months of treatment offers the best chances of success. So why? Why does that happen? We have the research, it's been proven time and time again. So one is people argue that people can't leave their jobs, they can't leave their schools, they can't leave their families for such a long or extended period of time. Um, and the way that I like to explain it is from here on going forward, your loved one needs to prioritize their recovery. Their recovery needs to come first. Their recovery is pretty much like a foundation on which they're going to build the rest of their life. And this foundation needs to be strong because if this foundation is not strong, anything else that they're going to build on this foundation is just going to come crumbling down. So if they're returning to a job, but they're not in a place where they can maintain their sobriety and maintain their recovery, they're going to relapse and they're going to lose that very job that they're returning to. Same with families. We also say that everything you put in front of your recovery, you're sure to lose. Um, you know, Addiction does extensive damage to families, to relationships. So again, it's if a loved one isn't ready, but they're returning to that family, that very family that is so important that they're returning to, if they relapse and if they're not ready, it's going to cause damage to that. So therefore, recovery needs to come first. This foundation needs to be really, really strong. Next one is the addict and the loved one wants to put the problem behind them as quickly as possible. They want to believe it will be fixed very quickly and they can go back to normal and they don't have to talk about it. And we get that. We get that it's so often such a difficult thing, such a challenging time. And we really just want this to go away. We want this to pass. We want things to just get better. And we almost want to go back to that place of we just want things to be the way they used to be. Um, but that's also a little bit of wishful thinking. Just because we want it so doesn't make it so. It requires work. It requires a lot of healing. It's not just going to be something that you can just put behind you, unfortunately. But if one really works at their treatment, if they get better, and if you have the time to heal, we have seen those relationships being restored. And we have seen things get better, but again, it takes time. The next one is we need to keep in mind that addiction is similar to any chronic disease, such as heart disease or diabetes, in terms of the attention and perseverance needed to remain healthy. So just like if you have diabetes or you have a heart disease, you need to adapt your lifestyle, you need to listen to the doctor's recommendations, you need to take your medication, and addiction is very much the same. It's a primary disease, which means we need to make lifestyle choices. Your loved one is going to have this for the rest of their life. So instead of viewing treatment as a sacrifice, we need to remember that the individual will gain so much more than what they will lose. They might lose some time. We get that. We get that sometimes it's really difficult to make that decision to keep them out of a job or, prolong the studies or prolong the time before they can return to the families. We really get that, and we really get that there's a lot of sacrifice that often goes into that, especially for you as the loved ones. Um, but again, there's so much more to gain at the end of that if this treatment is a success and if it's effective. Okay, so long-term treatment of changes, what does that look like? Secondary care, halfway house, outpatient aftercare, and living recovery. Again, just want to mention that through all these phases, we have case management, patients are assessed, their progress is assessed, and if we need to make adaptations to their treatment, that is discussed on an ongoing basis. So the first one is secondary care. As I mentioned earlier, the secondary care is also referred to as River Manor, or more affectionately referred to as the farm. And although we refer to it as the farm, it's simply referred to as the farm because, yes, there are some animals, but it doesn't mean that your loved one is going to a farm and they're going to slave away and with all sorts of labor. They do have some responsibilities with regards to taking care of the animals, etc. But what that literally means is in the mornings in their duties, they have to go and they have to feed and they maybe have to do some cleaning. And at the end of the day, they just need to feed the animals again. But predominantly, a lot of time is spent on treatment. Something about the farm as well is that it allows a lot of time for self-reflection. So we do have a lot of boundaries and there are a lot of rules again. But we spoke earlier about primary care being this ICU, and there's a little bit of a step down in terms of that intensity. So where primary care might have 5 or 6 group therapy sessions a day, we might have 2 group therapy sessions a day, along with other more introspective activities that the patients are able to do. So yeah, the farm has also been referred to before as the place where the magic happens. And again, we definitely do see it. And I think it is because of time. This process takes time. And yeah, it's really, really good to see when those changes do start taking place. So River Manor offers a safe, structured, and caring environment where patients have the opportunity to process their addiction, so in a lot more depth because they have more time than what they have in the primary care facility. Secondary care is also an inpatient basis, so they also stay at the farm, they sleep there, they eat there. That's their home for a period of time, and it really does become their home. One of the main purposes of our secondary care facility is to allow people to get past that 90-day mark. We've spoken about that. So again, it's about the individual care, individual needs. So again, following their admission, another biopsychosocial interview gets done. Their counselor gets to know them a bit more. We already know them because we've been part of the case management before, so we have a really good idea of who this person is before they come to us. But we also have the opportunity to sit with them, get to know them, develop a treatment plan. So we also, it's not just about detox and dismantling the denial. In secondary care treatment, there is a lot of focus on behaviors and the underlying emotional problems, the beliefs, the unhealthy habits that take a person back to active addiction. Again, because we have time to do that. That's where a recovering person can practice the tools that they need to stay away from drugs or alcohol. The aim of secondary care is to continue building on the positive gains made during the treatment at primary care. And clients are encouraged to continue to identify what needs to change and how change needs to be implemented. And that comes up all the time, whether it be, again, struggles within the family, whether it be struggles with toxic relationships, whether that be behavioral issues like dishonesty or people pleasing, lack of boundaries. All of those things become very evident during this phase of treatment, and a lot of education gets done around that, and they have the ability to learn and to grow from that and to implement what they've learned. So what does treatment look like at River Manor or in our secondary program? Again, the individual counseling, group therapy, psychoeducation, lectures and workshops. We have creative therapy. We also have a little bit of animal therapy. So just some of the interaction with the animals. Family involvement at this stage includes visitation every 2 weeks. Written step work, written assignments, community and peer support. We've spoken about that. And again, there's the around-the-clock care and supervision. If they need the support is readily available. Our halfway house. So our halfway house is known as our tertiary care facility, but the main focus of halfway house is reintegration. So one has either been in primary care and can go to halfway house. Sometimes one goes from primary care to secondary care and then to halfway house. But either way, no matter what the treatment program has looked like, the halfway house is there for reintegration. So for your loved one to slowly start reintegrating back into society, start taking on their responsibilities again, whether it be reintegrating back into family, reintegrating back into work. Some of them have the opportunity to start studying again. But that's what the halfway house does. So again, it is their home, it is where they stay, it's where they reside, but they have a lot more freedom of movement. Like I said, they can go to, if they have work, they can go to work, they can go to universities and study. They also have the opportunities to come home, to visit the family more regularly. But if there are any struggles experienced, they can come back to a safe place where they're held and where they're still safe. So it involves, I just want to go on from point number 3. So it involves maintaining abstinence and the initial treatment gains. So still staying clean, but also growing on all of the stuff that they have learned and growing in this process. The residence is designed to allow patients to return to more normal lives and routines, but it still offers that support and advice within a drug-free environment. Patients are encouraged to return to their employment or seek employment at this stage, or alternatively, they can study while at the halfway house with the necessary support. It helps people maintain and reinforce sobriety by providing routine and structure. So again, a lot of rules, a lot of boundaries, but what happens is that becomes the responsibility of the patient in treatment. So they need to abide to the rules. They need to do what's expected of them. They're not as intensely monitored as what they were in the previous ones. Yet, if there is a constant breaking of rules, there are still consequences, etc. Halfway house allows the patient to build confidence in their ability to live a clean and fulfilling life. So many times when one leaves the inpatient treatment, there's a lot of anxiety. When they go into halfway house and they start that reintegration, they can start seeing, okay, I can do this. It's difficult and it's challenging, and sometimes I do feel a little bit overwhelmed, but I'm doing this. I'm actually living life in recovery. So it's really beautiful to see that in Halfway House. So while residing at the Halfway House, patients are encouraged to connect to other sources of support. So the meetings, their 5 pillars, the fellowship. The longer duration allows clients to build and strengthen their recovery. Um, Again, it's just practicing those things that they've learned. So it changes Halfway House. There's the long-term sober living accommodation, assistance in finding meetings and reintegrating into the fellowship, or integrating into the fellowship, should I say. Ongoing support groups such as the outpatient and aftercare, and we'll look at that now. Ongoing individual counseling, regular check-ins, access to counseling times of vulnerability or crisis, and there's also extended assistance in achieving a balanced and rewarding life. So it's just that support while they're starting to really see the fruits of their hard work. Okay, so the next one is outpatient, and this is the first stage of our outpatient treatment. So this means that it's not a inpatient, so people don't stay and sleep. Outpatient treatment can either be done while your loved one is in the halfway house facility, so they're starting to reintegrate, or even if they're living at your home, they can join the outpatient program, and that still gives them ongoing education and ongoing support. It is recommended for people who have just completed an inpatient program. Very, very, very seldom do we have people that just do the outpatient program. The ideal for us is that a person should have done some sort of an inpatient program and then join this program. So the outpatient program takes place at our primary care facility at Northcliffe every afternoon from 4:30 until 7 o'clock. So your loved one has, during the day, they've either been at home or they've been working or they've been studying, but they've been doing normal life stuff. That at the end of the day, at 4:30, they come to the outpatient program, and that gives them some support. So many of them often say that it's just this little piece in your heart, in the back of your mind, that no matter what happens this day, I know I've got that at the end of the day. I know I've got my group that I can go to, who I can share with, who are going to hold me, and it's going to be a safe space for me. So benefits of outpatient treatment is, again, people can start reintegrating, they can work or they can study, they can continue with normal life. With outpatient, there's obviously a reduced cost, and there is less disruption to daily life. Outpatient program, it helps people to recognize triggers, manage them, prevent them. So it's a lot of the stuff that they've learned in the previous programs. Some of that stuff might be coming up now, and it really helps them just to solidify that. So they've learned about triggers, they've learned how to manage those triggers, and now they're out in real life and they're experiencing a trigger. They're seeing an old friend. And so it's about being able to come to the group and say, this is what happened, this is what I struggled with today, and getting that necessary support and advice from their peers, but also the professional staff. Um, so embracing that support network and sharing and relating on it with regards to their day-to-day struggles. Again, no matter what happened that day, I have the safety net at the end of the day. Outpatient offers lectures, group therapy, weekly counseling sessions. We also test all the patients on a regular basis because they're not just staying inside, they're outside. So they get tested on a regular basis. And again, there's that ongoing evaluation by the multidisciplinary team. Aftercare treatment. Aftercare treatment, sometimes patients go from either the primary care to aftercare, and that's really only if they're not in Joburg, if they're not in the vicinity to join the outpatient program, or even from the secondary stage to the aftercare. But again, when they're not in the vicinity to join at the Northcliffe, because the way the aftercare goes, and I'm not necessarily going to read through all of this because I'm just watching the time, but the way the aftercare program works is it takes place online. So again, we're stepping down in terms of that intensity, where our patients every day, 4:30 to 7. Aftercare is online 3 times a week, Mondays, Wednesdays, and Fridays from 5 to 6. Again, it's about having that ongoing support with peers who might be at the same stage as you, might be experiencing the same struggles as you, just having the opportunity to share what your struggles are and reinforcing some of the things that you have learned. Again, so that's the group therapy 3 times a week. It also includes a weekly counseling session, access to counseling services in case of an emergency, and again, that ongoing evaluation by the multidisciplinary team. I think that's it. Yes, the last one is living recovery. So that's the very last stage of our patient support group. And the minimum requirements here is that the patient needs to have 9 months or more clean time or time in sobriety. And that also depends on their progress. So again, we're stepping down in intensity. The other outpatient 5 days a week, aftercare 3 days a week, living recovery only once a week, again online, weekly group sessions. They also do still have access to counseling once a week. But this group assists in maintaining the coping skill that patients have learned during the process so that they can continue building a healthy and fulfilling life. Many people believe that recovery truly begins after rehabilitation, which is why it's so important that you receive the right support. So at this stage, they're usually quite settled. They've started with the reintegration, and this stage is really just about that maintenance, that supporting maintaining your recovery and your sobriety. Okay, family involvement. So how can you get involved? Again, we've spoken about this. This isn't just up to your loved one. You can also get involved. You can get involved by being here tonight and doing this every Tuesday. Also engaging with your loved one, participating in discussions when it comes to a continuum of care. So what's going to happen after this phase? What are we doing? Be involved in those discussions, not only with your loved one, but also with their therapeutic team. And sometimes it's necessary to discuss boundaries and the bottom line. So I'm only going to support you if you're doing the right thing, if you're choosing your recovery. Otherwise, I cannot support you. Okay, so in closing, recovery treatment's a lengthy process. It takes time for both your loved one and for you to heal. So please speak to your loved one's therapeutic team, to their counselors, in terms of what options are available and what their recommendations are. And again, please feel free to give your input during those discussions. I do know it's 7 o'clock, but I did see a few messages pop up. I don't know if there are any questions that anyone has. You're welcome to raise your hand, ask, and we'll give you the opportunity to ask some questions. And in the meantime, we'll also maybe address some of those that are in the chats. So there's a message from Dion and Eugenie. They're just saying we are very grateful for Changes that has changed all our lives in so many ways. Thanks to you all. Thank you, Dion and Eugenie. Danelle says, hi, for primary care, would the counsellors recommend, based on assessment, whether they would extend it from 21 to 24 days? Kate, I don't know if you can comment, or Sky, if you can comment on when is it 21 and when is it 24 days?
Basically, that's determined by the medical aids. Usually 24 is when it's detox is included, so it's 3 days of detox and then 21 days of what they call rehab, and it kind of just blends into one. But not all medical aids give the detox 3 days.
Mm. So I think just if you are unsure, just again, feel free to please speak to your loved one's counselor. They can definitely guide you in terms of that. Linnell's also asked for the outpatient treatment. Who do we contact to find out regarding costs? The best person to speak to is your loved one's counselor. They can give you the necessary costs, and yeah, they can have further discussions around that. Julie, Changes has been amazing, life-changing. Thank you for all your constant help and guidance. Thank you, Julie. And then Niles just said, does discovery included? We'll definitely ask the counselors. Yeah, again, so again, plan dependent, etc. Lanal. So maybe if you can just speak to your loved one's counselor, they'll definitely be able to answer some of these very specific questions and guide you. on the way forward. I think that's it in the chat, Sky. Don't know if
Yeah,
anyone
let's
else
see
has any
anything
questions. Sorry, I'm aware that we've just gone over 7 as well. But like I did say, if you have any questions with regards to the different phases of treatment, whether your loved one is in primary or at the farm at River Manor, please feel free to speak to their counselors, and I'm sure that they can give you a lot more information in terms of what it entails, the costs involved, and definitely what our recommendation is, which fit we feel might be best for your loved one.